Welcome to HEALTHe Newfoundland and Labrador. This education and training module will provide you with information about how to review a patient's medication profile, including the medication summary, dispense and prescription views, other medications, drug utilization review, and the privacy override. In order to access a patient's drug profile, you must first sign into the viewer. Once signed in, you can locate the patient whose information you wish to review, either by searching using their HCN or the recommended demographic search, first name, last name and date of birth, or by selecting the patient from your list of recent patients or from a favorite work list. Once you have selected the patient, either by selecting the patient from the list of search results or from a work list and clicking on the information fields for that patient, such as name or date of birth, you will see their information in the patient dynamic summary. Some of the information you will see includes allergies and adverse drug events, or ADEs. In the upper left-hand corner of the patient summary you will see the medication summary links. Select either the 4-month or 2-year views to see information for that period of time. 4-month or 2-year view you will see the medication summary, which displays a summary listing of the patient's dispensed medications. Each row in the medication summary presents an aggregate of data about the drug prescription and each associated dispense, if any. Clicking on the prescription icon, in a row of the medication summary windowlet, displays the prescription details in a pop-up window. Definitions for the medication status, including active, completed and aborted for the prescription status, with the addition of suspended for dispense status, can be seen in the table here. These definitions are also provided in the user manual and help files accessible by clicking on the help icon in the left-hand menu. Important note: currently, a 4-month view of the medication summary may provide data for up to 16 months. All dates will be displayed. This is a known issue whereby prescriptions dispenses beyond the 4-month 2-year date range may be returned. Prescriptions or dispenses that had an active status, such as a patient who is currently taking the medication or has refills remaining, at any point within the previous 4 months 2 years will be returned. Additionally, any prescription or dispense that has had an amendment, such as having a note added within the date filter, will also be returned. The drug prescription detail displays the detailed record information for a given prescription. The drug prescription detail contains the prescribed drug name as a heading, followed by sections of information containing data items such as substitutions, prescriber, fill refusal and notes. The medication summary displays the dispense details in a pop-up window. The drug dispense detail displays the detailed record information for a given dispense of a prescription. The drug dispense detail contains the prescribed drug name as a heading, followed by sections of information containing data items such as substitutions, dispensed by, status changes and notes. The other medication summary allows the user to view a summary listing of patient-reported medications, which were not prescribed by a clinician. Clicking on any row of the other medication summary displays the other medication details in a pop-up window. The other medication detail displays the detailed record information. By default, the medication summary is sorted by date prescribed, then by date dispensed. The results can be sorted in ascending or descending order by clicking on the data element column label. All information in these screens can be sorted by the following columns: drug, prescriber, prescribed date, status, and dispense date. Click the column you wish to sort the summary screen by. Click the column a second time to arrange in the ascending order. When sorting alphabetical listed columns such as drug, the system sorts the new list alphabetically. However, it is also case sensitive. Therefore, all lowercase results are listed first A to Z, and subsequently all uppercase A to Z. The drug utilization review is a component of the medication profile. Once you have selected the 4-month or 2-year medication summary, the DUR information is accessed by clicking on the indicator icon on a record in the medication profile. This icon is only present if there is a drug utilization review warning present for the given medication. The drug utilization review, DUR, allows the user to view warnings related to the patient's medications that have been generated by the pharmacy network, as well as review any management of the contraindication that may have been taken by a pharmacist. The drug utilization review is based on other potential drug interactions, allergies, etc. The clinical data presented in the dynamic patient summary may be restricted or limited due to information privacy directives present on the patient's electronic health record. When clinical data is protected by an information privacy directive, it is said to be masked. If records are masked, the clinical portal user is informed with a message that data is not shown due to privacy restrictions in the area of the page where data is normally expected to appear. As seen on this screen, once you enter the medication summary, both 4 months and 2 years where data exists, you will see the restrictions here as well. If necessary, you can override the privacy directive. Start by clicking the privacy override icon in the top right-hand corner of the patient context bar. Users can override privacy restrictions by receiving patient consent from either a patient or delegate and entering the keyword. Users can also override privacy via break the glass and will be required to enter whether the action is an emergency or based on professional judgment. Both patient consent and break the glass privacy overrides are audited. However, break the glass functionality will generate additional auditing. When applying patient consent to remove privacy restrictions, the clinician must first choose from a list, indicating who provided consent. Either the patient or a clinician has indicated who provided consent, they must then select the consent mechanism, either physical presence or verbal. Finally, the clinician will enter the keyword provided by the patient or patient representative and select the override button. In the absence of patient consent, an example of this may be an unconscious patient, clinicians can use the break the glass function to temporarily remove the privacy restrictions from the patient's record. The clinician can enter one of 2 choices for the break the glass function, either emergency or professional judgment. Using the break the glass functionality will trigger additional auditing. You have just completed the medication profile online training module for the HEALTHe NL viewer. Please visit the website provided for more education and training information and material.